السلام عليكم بناتي وأبنائي الطلبة الأعزاء. أسأل الله القدير أن يوفقكم وأن تنالوا النجاح ونيل شهادة البكالوريوس في الطب والجراحة العامة، وأن يحميكم أنتم وعوائلكم من هذا الوباء الخطير. Our lecture today about the anatomy and physiology of the nose and paranasal sinuses. The nose is an important part of the face. It gives the individual his characteristic appearance. The nose is divided into two parts. One, the external nose. Two, the internal nose or nasal cavity. Now, the external nose. It is the prominent part of the face, pyramidal in shape. The apex and the tip of the nose and the base is attached to the area to the forehead. The external nose projecting downwards and is perforated by two apertures called the nostril, which are separated by the columella. The lateral surface join along the dorsum of the nose where meet the forehead. The external nose has a skeleton made up of bony and cartilaginous parts. The bony parts is composed of two nasal bones, the nasal process of frontal and maxillary bones. Clinically, the nasal bone commonly get fractures by facial trauma. The cartilaginous part of the nose is made up of two parts, which are the lateral cartilage, upper and lower cartilage, and these cartilage are connected by fibrous tissue. The lower lateral cartilage help in shaping of the nostril. The outer surface is covered by a skin which is thin and mobile above and thick and adherent to subcutaneous tissue near the tip. A clinical point, the surgical refashioning of the lower lateral cartilage is an important in rhinoplasty. Now, the internal nose or nasal cavity. The nasal cavity is divided by midline partition, which is called nasal septum, into right and left chambers. It extends from the nostril in front to the choana, which is the posterior nasal aperture or apertures behind, where it opens into nasopharynx. The entrance to the nasal cavity is called nasal vestibule, which ends at the mucocutaneous junction and it's lined by a skin that contains skin appendages. Clinical point here that the vestibule is a common site of developing boil or infection because of the presence of hair follicle. The right of the nasal cavity is lined by respiratory mucosa, which is pseudo-stratified columnar epithelium ciliated type, and a small area is lined by olfactory epithelium. So the nose has three types of lining: skin, respiratory, and olfactory. Each nose has roof, floor, medial and lateral walls. The floor is formed by the palatine process of maxilla and the horizontal plate of palatine bone. The roof is narrow and is formed by from behind forward the bony part of cribriform, or the body of the sphenoid, the cribriform plate of ethmoid, and the frontal bone. Here, clinical point: cribriform plate is a thin plate, and it is easily fracture in head injury and may lead to CSF rhinorrhea. The midline wall, which is called nasal septum, is an osteocartilaginous partition covered by an adherent mucoperichondrium and mucoperiosteum. The upper part is formed by perpendicular plate of ethmoid bone, and the posterior part is formed by vomer, and the anterior part or portion is formed by the nasal cartilage. The lateral wall of the nose is complex, and it contains shelf-like projections that lies into the nasal cavity, and this called turbinate or conche, the superior, the middle, and the inferior. The groove below each turbinate is referred as meatus, and there are 3 meati, which are called superior, middle, and inferior meati. Into those meati, the paranasal sinuses open and join the nasal cavity. The area above the superior turbinate is called as sphenoethmoidal recess. The inferior meatus contains the opening of nasolacrimal duct. The middle meatus contains the opening of the frontal, maxillary, and anterior ethmoidal sinuses. The superior meatus also receives the opening of posterior ethmoidal sinuses. The sphenoethmoidal recess receive the opening of sphenoid sinus. This picture shows the turbinate and the meati. The blood supply of the nasal cavity. It is supplied by branches from internal and external arteries. The internal or the branches of internal arteries are supplied the area above the anterior, or the area that lies anterior and posterior ethmoidal, which are the posterior and ethmoidal arteries, whereas the external carotid artery supplies the nose through its maxillary branch and contribution of the facial artery. The internal carotid artery and external carotid artery branches anastomose freely in the area which is a common site of stenosis, and this area lies into anterior-inferior aspect of the nasal septum, which is called Little's area, and the arteries that share in this anastomosis, which is called causal plexus, are sphenopalatine artery, greater palatine artery, superior labial artery, and the branch from the anterior ethmoidal artery. The venous drainage. The nose characterized by a rich submucosal plexus of veins or of venous sinuses. These drain by veins accompany the arteries mentioned above. The lymphatic drainage, the nose drain into submandibular lymph node and the upper deep cervical lymph nodes. Now the nerve supply of the nose. 1, 2, 3. 1 is the olfactory nerve. This arises from specialized olfactory epithelium in the olfactory mucosa. They ascend through the cribriform plate of ethmoid to olfactory bulb. 2. Nerves of ordinary sensation, and they are from ophthalmic maxillary division of trigeminal nerve. 3. Vasomotor nerve supply, which are autonomic nerve supply, and the parasympathetic, which is stimulate causes vasodilatation and stimulate glandular secretion. B. Sympathetic nerves that its stimulation cause vasoconstriction and inhibition of glandular secretion. Now we will come to the paranasal sinuses. Paranasal sinuses. These are air-filled cavities within the bones of the skull. They are 4 pairs of sinuses divided into anterior and posterior groups. The anterior group contains the frontal, maxillary, and anterior ethmoidal sinuses. The posterior group contains sphenoid, posterior ethmoidal sinuses. The anterior group drain into middle meatus of the nose, while the posterior ethmoid cells drain into superior meatus, and the sphenoid sinus drain into sphenoethmoidal recess. Now, a little bit about each of these sinuses. Maxillary sinuses, or the maxillary sinus. It is pyramidal in shape and lies within the maxilla on each side of the nose. The roof of the sinus is formed by the floor of the orbit, and the floor is related to the root of the second premolar and first molar teeth. Medially, it is related to the nose, and posteriorly to pterygopalatine fossa. The maxillary sinus open into middle meatus. Frontal sinus. The 2 frontal sinuses contains within the bony frontal bone. Bony septum separate the 2 sinuses, commonly unequal. It is related anteriorly to the forehead and posteriorly to the anterior cranial fossa, and inferiorly to the nose and the orbit. Each sinus open into middle meatus. Sphenoid sinus. The 2 sinuses lie within the body of sphenoid bone, and each sinus open into the sphenoethmoidal recess above. Above the superior turbinate. It is related laterally to the cavernous sinus and optic nerve and internal carotid artery. It is related superiorly to the pituitary gland and inferiorly to nasopharynx. Ethmoid sinus. The ethmoid sinuses divided into anterior and posterior groups and contains with the body of ethmoidal bone, and each side of the orbit laterally and the nose medially. A thin sheet of bone called lamina papyracea separate these sinuses from the orbit. Their roof is directly related to the anterior cranial fossa and the anterior ethmoidal air cells open into middle meatus and the posterior ethmoidal air cells open into superior meatus. Physiology of the nose. The nose has several functions. One, respiratory function, and this includes to provide air for respiration, filtration of the inspired air, humidification of the inspired air, adjust the temperature of the inspired air. Two, olfactory function. Three, phonatory function. It provides a voice with resonant quality. Thank you.